Today in this session we have Dr. Vidyashree. She is a pathologist and a research officer working in Central Ayurveda Research Institute, Bengaluru. She also holds a fellowship in transfusional medicine from NIMHANS. And in this session she will be answering to some important queries related to the role of investigations in diabetes. Welcome, Doctor. Doctor, let's begin with a very basic question, that is when to do blood test for diabetes, or how do I know that I might have diabetes or I might need some tests?
So to answer your question, so first we should know what is diabetes. So what happens, generally whatever food we consume, it is broken down into glucose. So our body cells absorbs this and it produces energy. So in this process, insulin is used, which is produced by the pancreas. So this helps in breaking down the food that we consume into glucose and produce energy. So in diabetes what happens is there is either insulin deficiency or there is low amount of insulin that is produced, or even if the insulin is produced in normal quantity, the body is not able to use the insulin properly. So because of this, what happens is the cell is not able to absorb this glucose, and this glucose remains in the bloodstream, because of which the blood glucose level increases in our body. So that is the reason why blood glucose levels are high in diabetes patients. So usually when this diabetes is there, the patients usually present with different symptoms, like they feel very thirsty, or they feel very hungry, or there is increased urine in the night, increased frequency of urination in the night, or they are also present with itching skin or dry skin, and they are also prone for many infections, and also the soles might have some injuries. So these are the different symptoms when they are seen in common people. So there can be suspicion of diabetes and they have to visit to the nearest hospital or nearest doctor possible and get their blood test done.
And what are the different types of tests to be performed in diabetes?
There are different tests that can be performed in diabetes. The basic common test is the fasting blood sugar, also called as FBS. So in this FBS test, the patient comes fasting, overnight fasting. The last meal can be around 9 o'clock or 10 o'clock. And after the fasting of around 8 to 10 hours, the patient will come early morning in the morning to give his fasting blood sample. And here the blood sugar is tested. So the values of around 70 to 100 is considered normal, and around 100 to 125 can be considered as pre-diabetes, and more than 126 can be considered diabetes when it is tested in two different occasions. So this is the common test FBS, and other test is the PPBS, that is the postprandial blood sugar. Usually when the food is consumed, it is broken down within 2 hours, and only the marginal increase in the blood sugar level is suspected. But in case of diabetes, this can be increased because the insulin is not acting, because of which the blood sugar level can be much more higher than what is expected. So in this postprandial blood sugar, around 100 to 140 is normal, above which it can be considered suspicious for diabetes. Third test which is commonly done is the HbA1c, that is the glycated hemoglobin. So this gives an average glucose level in the hemoglobin for around 2 to 3 months. So what happens is here the glucose which sticks to the hemoglobin, that is counted, and the average lifespan of RBC, that is the red blood cells, is around 120 days. So whatever the glucose that is sticking to the RBC, it can survive up to this 2 to 3 months. And that average range can be calculated. So this HbA1c, if it is less than 5.7, it is considered as normal, whereas between 5.7 to 6.4 can be considered as pre-diabetic, and more than 6.4 can be considered as suspicion for diabetes, and this also has to be measured 2 times to confirm the diagnosis of diabetes. The other commonly performed test is urine sugar. So normally in healthy individual, the glucose is reabsorbed and the sugars are not present in the urine, or present in very minimal quantity. But in diabetes what happens is, because of high sugar levels in the blood, the kidneys are not able to reabsorb it back, and the sugars are passed in the urine, and high levels of sugars can be seen in these diabetic patients. The other test is commonly performed is complete blood count, that is CBC. That is just to rule out if there is any other underlying diseases which needs further investigations. The other commonly performed test is the cholesterol test. So this cholesterol test is performed because cholesterol is usually required for the body, but there is something called as good cholesterol and bad cholesterol. So in diabetes what happens is it lowers the good cholesterol and it increases this bad cholesterol, which is the LDL cholesterol and the triglycerides, because of which the cholesterol there is abnormal cholesterol or high triglycerides and LDL cholesterol can be seen. So this can be a very dangerous effect. There can be a possibility of cardiovascular diseases and any stroke also. The other test that can be performed is the urea and creatinine. This is to check the kidney functioning of the body patient. So as a result, then we can also perform this serum electrolytes. So in diabetes there will be abnormal sodium, potassium or chloride level which can be suspected in case of, especially during the complications of diabetes like diabetic ketoacidosis or hyperglycemia. In diabetic ketoacidosis, what happens is since the glucose is not able to generate the energy, the liver starts breaking down the fat and produces energy, because of which these acids are produced called the ketones. So high levels of ketones can be also be expected in diabetes, especially in case of diabetic ketoacidosis. So these are the different tests that is commonly performed in diabetes.
Okay, doctor. Now we explained about different types of tests in diabetes. So how often do we need to do these tests?
This is a very common question in every patient's mind, when to do the test. So it totally depends on the type of the diabetes and the severity of the diabetes, the age of the patient, pregnancy or any diabetic complication or in overall health of the patient. So generally when the age of the patient is more than 45 years and presenting with no symptoms, as a precautionary measure the blood test can be performed every 3 years. But if the patient is having type 1 diabetes or having type 2 diabetes and taking insulin injections, then maybe daily blood test might be required at home using the glucometer. Or if the patient is having controlled diabetes and taking only oral medicines, then maybe every 3 to 6 months this test can be performed.
Okay, doctor. Then can we do these tests at home or do we need to go to laboratories?
All these tests cannot be performed at home. The patient has to visit the nearby laboratory. However, the sample collection can be done at home by the collection person, phlebotomist, and the sample has to run in the laboratory. But the blood sugar level can be monitored at home, especially if they are checking regularly, by using a glucometer where a small prick is done and the sample is a small drop of blood is taken in the glucometer and it displays the blood sugar values. But this can be done for a daily check. However, every 3 to 6 months even this should be cross-checked in the laboratory, because the quality check and the calibration is usually performed in the laboratory. In the regular glucometer which is at the home, we do not know what is the quality check of that or the calibration of this machine. So patient has to visit to the nearby hospital.
Okay, doctor. Then can you briefly explain what are the prerequisites for performing these blood tests?
These blood investigations are very important part of this diabetic management. So especially the prerequisite required is that balanced diet should be consumed by the patient 2 to 3 days prior to the blood investigation. And especially day before the blood test, we must be very sure that patient should not have consumed any intoxicating substance like alcohol or tobacco. And also necessary specific medications, if it is taken, then the note of that should be made. And patient should not undergo any vigorous exercises that is usually done before doing this blood test. That is not required. We should not do any vigorous exercise. And when you are coming for fasting blood sugar or lipid profile, make sure that there is fasting of around 8 to 10 hours and then the blood test is done. And for the postprandial blood sugar, 2 hours after starting the meal should be done, and then regular anti-diabetic medication should be taken, and then only the the blood test should be performed.
Okay, doctor. Then finally, why do we need to do blood test in diabetes? Or what is the relevance of doing blood tests in diabetes?
Diabetes can affect any part of the body from the eyes to the toes. So these investigations are very much relevant in diabetes. So identifying what is the level of the blood sugar, is it high or is it low, we need blood investigations. So So even to track what is the our medication progress or what is the lifestyle or diet changes that we have done, how it is affecting our body, can be known by doing these blood investigations. Not only this, even other illnesses or stress, how it is affecting our blood levels can only be known by doing this investigation. So doing this investigation is very much important, and this laboratory setup is very much important in diabetes management is what I would like to tell.
Okay, doctor. Thank you so much for sharing these valuable informations. Thank you, doctor.
Thank you so much for calling me. Thank you.